We'll go the way of heavy metals like arsenic.
100 years ago, doctors used the poisonous metal to treat syphilis until penicillin was discovered. Poisonous metals are still being used in chemotherapy, though, but a few FDA-approved cancer treatments may change all of that.
We have found something that's more targeted, that hones in on the cancer and does not cause as much collateral damage, so to speak.
At this point, chemotherapy is still important in the treatment of cancer, but for most patients, the side effects can be brutal.
Chemotherapy can cause things like loss of hair, nausea and vomiting, severe fatigue, sores in the mouth, diarrhea.
Chemotherapy attacks all cells, not just the cancerous cells. That is why chemo makes patients weak. What many people don't know is that some cancers really don't respond well to the treatment.
For example, kidney cancer doesn't respond very well to chemotherapy. Melanoma, a type of skin cancer, does not respond very well to chemotherapy. These are just a couple of examples. Prostate cancer responds a little bit, but not really very well to chemotherapy.
On the other hand, chemo does help with testicular, breast, colon, and lung cancer. Some celebrities like Suzanne Summers have been outspoken about avoiding chemo at all costs with natural methods.
The herbs are unproven. Those herbs that have been tested have not been found to be very efficacious.
But you do have other options.
Several monoclonal antibodies that are humanized, that is, they don't have any foreign proteins in them, and those humanized antibodies really don't have any side effects. One of them, for example, is Herceptin or trastuzumab that we give for breast cancer.
Some antibodies that are used to treat lymphoma and colon cancer do contain mouse proteins, so you may experience swollen lips and a drop in blood pressure. Hormones are also being used to treat breast and prostate cancer.
For breast cancer, for example, we will frequently give women who are premenopausal tamoxifen. It's been around for a long time. It's an anti-estrogen hormone. And there is an enzyme inhibitor called aromatase inhibitor that we give for postmenopausal women. And these medications sometimes can be used instead of chemotherapy.
Doctors have also seen some success with key vitamins.
A relative of vitamin A, triretinoin, seems to be very effective in treating acute promyelocytic leukemia.
When dealing with cancer, you should always remember that prevention is much different than treatment, and never take it on by yourself.
It's probably good advice to seek the counsel of a medical oncologist or a surgical oncologist or a radiation oncologist before self-prescribing these sorts of things.